I never liked my nose. I made the decision when I was really young. I also worked with a therapist who supported me in making this decision.
What risks did you become aware of?
Well, I think the biggest fear for those of us going through this surgery is once you sign the consent form, you end up with 1,000 more fears.
What made you feel safe enough to actually move forward?
Not everything depends on the surgeon's hands. It also depends on our bodies, on how we heal. The doctor said that when he tried to work on my nose, I bled a lot, which made the surgery more complicated.
Oh, what do you think changed more, your nose or your internal dialogue?
I think it goes hand in hand. There was a change in my nose, but there was also a change in my confidence. I didn't want my insecurity or my fear to keep me from seeing the real results.
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Paula spent years hiding her nose. She finally chose rhinoplasty. But would changing her nose actually change how she felt about herself?
Hello, Paola. Thank you for joining us today. You have had rhinoplasty. Share with us, when did you feel in your life that maybe you might like a bit of a different nose?
For as long as I can remember, I think it was during my teenage years when I felt it the most. But honestly, I think it started when I was really little. I never liked my nose. It was always kind of a dream to get surgery, to be able to change it, but I can't say exactly when it started. It wasn't a specific moment because I grew up with that insecurity.
So you kind of felt like your whole life that maybe you might want to make some changes in your nose. Is that correct?
Exactly.
Okay, perfect. What did you feel? Like, show me on your nose if you can. What did you feel were the areas where you wanted a little change?
Mainly, this specific area right here had like a small noticeable bone, a bit of a bump, and it was positioned really quite low. So, yeah, it was mainly this part that I wanted them to lower and lift up a little more.
Beautiful, beautiful. Simple asks, right? Well, how did you feel? What was your internal dialogue as you kind of went through life and you knew you wanted to make these changes? How did you talk to yourself?
I looked up a lot of information. I did a ton of research. I joined different groups, reached out to different girls who had already gone through the process. I made the decision when I was really young. I told myself I was going to get my nose done. And ever since I was little, it was a dream that I kept researching. No, I never got a quote because I didn't have the financial means at the time, but I did do my research and I knew it was a whole psychological process. When I actually went through with it, I also worked with a therapist who supported me in making this decision because honestly, it's the center of your face. So I think it really was months of preparation. But even so, when I finally made the decision, everything happened really fast. And I do feel like maybe I should have given myself more time between meeting the doctor and the surgery because it all happened within a week.
Paula, I'm so impressed that you included a therapist in your evaluation. I think it's so important to make sure that we're making these decisions for the right reasons and we understand the emotional weight that we're kind of playing with when we make a decision that is about the center of your face, as you say. I think it's a great example to set.
Yeah, and mostly because in the groups I was part of, there's something called body dysmorphia. So people who had good results with their nose still didn't feel comfortable, didn't like it, or complained about the surgeon. So a lot of the comments were like, well, I think you need a psychologist more than surgery because there's a bigger issue there. So I didn't want that to happen to me. I didn't want my insecurity or my fear to keep me from seeing the real results. So that's why you have it. And in fact, there are surgeons themselves who recommend that you go to a therapist. I followed a surgeon closely. He has his own therapist and put them through a therapy process before surgery. So I considered it very important, and that's why I made that decision.
Seeing a therapist before any type of aesthetic procedure that is major seems so healthy, and I commend you. I think that's a wise choice, and it sets a great example for other women considering rhinoplasty because you went through a big change from what I see from your before and your afters. And just so you know, your before photo, I actually think you had a very beautiful nose. I went to high school with a girl who had a nose exactly like that, and I always admired her very unique nose. We got in a lot of trouble together, but she was one of my good friends, and I thought it was beautiful. But at the end of the day, you wanted to change your nose. So we get to make that choice. Paola, on a scale of 1 to 10, 10 being the highest, how much did you want to change your nose?
How much did I want to change my nose? Yes, 15.
Okay. 15 out of 10. I love it. Okay. So very much. And you went through the emotional therapy and you made your decision. Where did you then research to find the surgeon that was right for you? What was your process to research?
I looked up a lot of profiles on Instagram and Facebook, and I also asked a lot in that community I was part of, like for doctor recommendations. I actually only went to to the surgeon. I researched a lot of surgeons, got quotes because I asked about the cost of the surgery through messages. Some told me it depended on my case, others already had a set price. So I picked the ones that were within my budget and went with the doctor whose work matched what I wanted most, because every doctor has their own way of working. So I saw that doctor and thought, he does noses like the one I'd like to have. Or I looked for cases with noses similar to mine. And his results, so I checked out his work, looked at the noses he'd done, contacted girls who had surgery with him, and I went to a consultation. He did a simulation for me, and I said, he's the one. I didn't consult with anyone else after that. He fit perfectly within my budget, and I really liked his work. Plus, he was both a cosmetic surgeon and an ENT specialist, which was exactly what I was looking for. Not just something aesthetic, but also a functional nose. A week later, I put down the deposit, and the following week, I had the surgery.
Okay, so if you were getting another rhinoplasty, which we hope you never have to do, the things that you would suggest a patient like you researching is the vibe of the doctor, proof befores and afters. And I think it's great that you were able to contact some of his patients to actually talk to them. The right surgeon to be your rhinoplasty surgeon. What risks did you become aware of?
Well, I think the biggest fear for those of us going through this surgery is the outcome, not liking the result or it not being what we expected. But once you sign the consent form and you're about to have the surgery, and they tell you about all the possible risks, you end up with 1,000 more fears. There could be brain issues, the anesthesia. After all, it's still a surgery at the end of the day. So, yes, I had a lot of fears on the day of the surgery. But if you ask me before the outcome, I think that's the biggest fear we all have, that we won't like the result.
And that's a risk. Yes, you're investing a lot of money, time, emotional effort, therapy into getting the result that you want. And it's possible that you might not get the rhinoplasty result that you want. Knowing these risks, and especially the one about, you may not get the result you want, what made you feel safe enough to actually move forward?
Trusting the doctor and trusting the process, because not everything depends on the surgeon's hands. It also depends on our bodies, on how we heal. So it's something you need to research, and you have to prepare yourself mentally that you won't see the final result until after a year. In fact, as of now, my rhinoplasty was 4 years ago, And even now, there are still changes in my nose. Some days it's a little more swollen, some days it's really slim. So you have to prepare yourself mentally that there are a lot of factors, and you need to be ready for anything, for whatever comes.
Right. Okay. So I did not know that even 4 years later, I guess the nose can change and morph, and just like a nose that hasn't been operated on. And that's just something we need to be aware of, whether you had rhinoplasty or not. Is there anything, looking back now after having rhinoplasty, is there anything you wish you had known before the procedure actually took place, the surgery took place, or do you feel I had as much information as I needed?
I think I did know that. Well, even I didn't expect that 4 years later, there would still be days when it looks different. But no, they're not really big changes or anything. But no, there's nothing that I think I did really good research.
Okay, great. And just in terms of that research, it sounds like you're in some Facebook groups, likely around rhinoplasty. So you're hearing questions happening in those groups. Can you recall anything that you think, gosh, the members of those groups, they might have considered asking these questions, like they were missing this type of question about the procedure?
I think so. There were people who went ahead with surgery without doing proper research, and that's why they either had bad results or don't see their nose the way they want. Because you also have to mentally prepare yourself for your type of nose, your face, the kind of face you have. I can't ask for a result like a nose I saw on the internet when that person's face isn't the same as mine. Maybe their face is slimmer, more delicate, so they have the chance to have a finer nose, or their skin is thinner. Mine was thicker. So a lot of people fall into that misinformation, saying, I want this kind of nose, and if I don't get this kind of nose, it was a bad job. So it's about asking the right questions, doing the right research. And you have to realize that not everything depends on the surgeon, but also on you knowing what kind of nose you have and what kind of nose you can realistically have after surgery.
Exactly. And skin thickness is so important to outcome. So you had thicker nose skin. What did your surgeon tell you about having thicker nose skin? How would that affect his procedure, his technique? Did he give you a little bit of insight into how it may or may not look differently than what you would imagine?
Yeah, actually, I thought my skin was thin, so I went in thinking this is going to be an easy job. He can give me the nose I want because my skin is thin, and it doesn't look like it'll be a lot of work. But when I went in for the surgery, he told me, You have thick skin, and it's a little harder to work with that kind of skin. So, yeah, that's how it was. It was a shock because I went in with a different idea and wanted a different kind of nose. But well, at the end of the day, it's like we said before, I was basing everything on the internet. And then during the consultation, he did a 3D simulation for me. He edited my nose so I could see how it might look. And honestly, there was not much difference between that simulation and how it actually turned out. That's when I thought, well, it's not exactly what I wanted, but I like it. I'll take it. I'll accept it. And so, yeah, you kind of walk out thinking, well, it is what it is. But you trust the process and you trust the surgeon. And something my partner told me at the time was, look, it's going to look better than how you have it right now. So I think that's what I kept telling myself.
I love that, and I cannot imagine being able to actually see a 3D evaluation of your nose. I think that would give me a lot of trust. Like, this surgeon is really digging deep and taking a look at even, the skin thickness or thinness and taking the time to put together the right game plan. That feels so wonderful.
And it's nice because when you see it, I think what happened to me was that I started dreaming about that nose. I mean, when I saw the edit he did and how my nose could look, I was already dreaming about it. I could already see myself with it, and I just wanted to have it, you know?
You just manifested your new nose, right? I love that. You know, Paula, many of our listeners are beauty seekers like you or me. We're getting procedures and treatments and we're taking care of ourselves. I don't know how often they would actually get an explanation of the day of a rhinoplasty surgery. Can you walk us through, the procedure? When you walked in that day, they handed you a glass of champagne and then what happened?
I remember a lot since everything happened so fast. I told my mom just one day before the surgery that I was going to have the operation. So, for the same reason, I didn't want anyone to plant fears in me. Because what do you mean you're getting surgery? And with whom? And who is the doctor? Etc. So, when I arrived at the clinic, my mom and my sister were already there. They came in with me. I went to the preparation room. They changed my clothes. The surgeon came with me, showed me the simulation again, and talked to my mom. He explained to us how the process would work and how long it would take. They took me into the operating room, and I remember very clearly that the anesthesiologist was really cheering me on so I would stay calm. And he started counting, and from there, I don't know, I just fell asleep. I usually wake up and I was alone. I don't remember much. I think I was alone. And then my boyfriend came in a while later, like in the recovery room. I was super dizzy and I actually ended up throwing up because of the anesthesia. My throat hurt a lot. I remember it was because of the tube they put in during surgery. My throat hurt more than my nose. That's what I remember most, that the whole day of the surgery, my throat hurt way more than my nose. And I felt kind of groggy. And then came the whole process, the recovery. But during my surgery, I remember they told me it lasted longer than expected. I don't remember exactly how long it was supposed to take, but the doctor said that when he tried to work on my nose, I bled a lot, which made the surgery more complicated, took a little longer. He had a harder time, but everything turned out fine, thank God. And I think it ended up taking maybe an hour or two longer because of that.
Okay, great. Can you just outline the areas on your nose now that you love the most that weren't there before you got your rhinoplasty?
I think that, like, from the front, this area is thinner, and obviously from the side, well, I don't have the bone here anymore. So these two areas are kind of my favorites.
Awesome. And how's your breathing? Anything happen with your breathing?
I have something called rhinitis, so I suffer from a lot of allergies, and that's just something I'm going to live with for the rest of my life. And it didn't go away, so I still breathe the same as always.
Okay, great. And does your nose feel different now, like firmer here or lighter skin here, or does it feel different to you than it did before?
Mm. You can't move it around like before. And actually, the tip is firm now. It's not like you can just move it. I think the main change is in the tip, which is firm. I can't really move it up or down. It's just stuck like that now.
In the light, when do you take photos and you see really the light plays differently on your nose? How does your nose look different just based on different lights now versus prior to your surgery?
Mm, I remember that before my surgery, I used to look a lot for the right lighting, the right angle, so that my nose wouldn't look too thick or pointing downward. Now, I don't really have that problem. Honestly, I hadn't even thought about it. I don't really change it much because I like my nose from every angle.
Yeah, your nose is beautiful. How would you pose prior to having the surgery for photos? Did you have a certain way you posed and now you just posed anyway?
Before, I would never in my life take a profile picture. I always tried to hide my profile. Now I even pose like this. I just don't have that problem anymore. I turn like this or do this. I don't hide it at all anymore.
Okay. And so, Paula, what do you think changed more, your nose or your internal dialogue?
I think it goes hand in hand. It really does. Because, yes, of course, there was a change in my nose, but there was also a change in my confidence when taking pictures. I don't feel insecure anymore. For example, right now I have a 9-month-old baby, and I have thought about how before our photos would have been complicated because we have pictures where I'm kissing her on the cheek or where I'm looking at her like this, and I see my nose, and I think, wow, I wonder how my insecurity would be now with my baby if I still had my old nose, which thank God I don't anymore. But I really think both things go hand in hand.
Yes, and humans feel the energy of the people who are around them. And if that emotional consideration was always with you, that could transfer. So it seems as though you're in a very healthy place. You've made a very healthy decision for the right reasons. And now you're able to kind of instill or just kind of exude that confidence. I feel it. And we love that your baby can feel that as well. That's amazing. What do you feel that beauty seekers who are watching this channel, beauty seekers like you, like me, what do you think they should try to understand if it was a single thing before electing rhinoplasty? What do you think that most important thing or things should be?
This transformation is not only happening right here, but also here, deep inside your own head, within your thoughts, and most significantly, in your self esteem.
I love that. If you could go back to your initial consult for rhinoplasty, is there one question that you might ask that you didn't ask at that time?
I don't think so. Honestly, everything was very clear. Everything happened very quickly. My body also did a lot of the work. No, I do not think there is anything else that I would need to ask you right now.
Yeah, it sounds as though you were very well informed by your surgeon and the talented group that surrounded your surgeon through that process. Let's say you got to the consult, you knew what you wanted, you were vibing. What, if anything, would have made you reconsider or walk out of that consult?
Not having connected with my surgeon, I think that's something really important. Not having felt that kind of match with him that would have made me doubt even a little bit, I wouldn't have gone back to him.
Hugely important. You would walk out of a consult if the vibe just didn't exist. I mean, that is key. That has to be essential. And all of the education and knowledge is on top of that. That makes so much sense. I love the fact that you are able to be just public and present about this story of this life-changing event that you've gone through. The beauty seeker community is very grateful. I'm so thankful for you. Um, One final question. After all of this, how has your relationship with your nose evolved or changed?
Well, it changed completely for the better. I enjoy putting makeup on it. I enjoy looking at it. I enjoy seeing myself. So it really changed completely for the better. It's no longer an insecurity. Well, everything changed. Everything changed in that way, in me and who I am, and of course, in my nose. I look in the mirror and say, I made the right decision.
I think you made the right choice as well. I can just feel it in, the level of confidence, the way you speak, considering how people around you, like especially your baby, is going to perceive you emotionally. You seem to have gone through like the right process. It was made rather quickly, the decision from therapy to actual procedure, and that seemed to work just fine for you. You seem to have the right emotional approach to the entire process. And I'm very happy for you. And thank you so much for sharing your experience with these beauty seekers that we're all part of this community. For those of the community who want to learn more about rhinoplasty, watch our next video with Dr. Vranis, who's actually going to give you the techniques, some of the techniques of how he does rhinoplasty. Thank you. Thank you, Paula.
No, thank you all so much. Honestly, it's been many years since my surgery, and I hadn't thought about how much my life has changed up to this point. And I hadn't thought about how much I can share with other people who want to go through this surgery. So, thank you so much for that.
Paula, we want to thank you. You are in Mexico and speak Spanish. I'm in Minnesota and speak English. And so we had a translator, Hilda, your great friend, and actually someone who is a great contributor to Beauty Seek. Hilda, tell us about your supporting Paula through this process.
Sure. We have been friends since we were really young, more than 10 years. So I saw her before, I see her after the procedure, and I seen how it boosted her confidence and how she has this different drive and just fitting her life with her baby and everything. It's really good to see how confident she has gone.
Well, thank you so much. And you two are a beautiful, beautiful friend pair.
Thank you.